This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Are you tired of logging into multiple systems and duplicating your work? Managing your practice's payments can be complex and time-consuming, but it doesn't have to be. With Dr. Chrono, you have access to our payments feature, which is fully integrated, so you save time and get paid faster. A game changer for medical practices. With Dr. Chrono Payments, you can process more payments, minimize administrative tasks, and streamline your workflows. Streamline the payment process and improve revenue streams in one unified platform. Visit drchrono.com/payments. That's drchrono.com/payments today to see how Dr. Chrono Payments can transform your practice.
Hello, Doctor. This is Dr. Shane Purcell. Let me ask you a question. Are you ready to reignite your passion for medicine? Join us at one of our Direct Primary Care Alliance Mastermind Weekends. These events are designed for physicians who are eager to build a thriving direct primary care practice and regain their independence. This is your opportunity to rejuvenate your career, expand your professional network, and make a significant impact on the healthcare industry. Register now for a Direct Primary Care Alliance Mastermind Weekend and take the first step towards a more fulfilling professional journey. Register at dpcalliance.org. See you there.
Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Dr. Beth Galla was raised in Palo Alto, California, but fell in love with North Carolina during her undergraduate years at Duke University, where she graduated magna cum laude with distinction. While at Duke, she had the privilege of running on the Blue Devils women's track team and was a member of the school record-setting 4x800 and distance medley relay teams. She then received her MD from Wake Forest University and went on to do her pediatric residency at the Children's Medical Center of Dallas UT Southwestern. Dr. Galla then returned to the West Coast, where she spent 11 years as a primary care pediatrician and as a hospitalist at Lucile Packard Children's Hospital. She married Matt Galla, and together they had 3 boys in under 4 years. Yearning to return to North Carolina, the Gallas moved across country in 2012 and settled in Holly Springs. Dr. Galla cherished 9 years practicing at Oberlin Road Pediatrics in Raleigh. She became very fond of her loyal patients and wished for the ability to spend more time with each family. So she ventured out on her own to practice medicine the way she feels most comfortable, with a focus on time. Time to listen, time to ask and answer questions, time to really think about problems, time to return texts or phone calls promptly, time to relay test results, time to speak with specialists, and time to be there for her patients and their families whenever they need it. Dr. Galla has an additional medical passion outside of her office, which involves her work as the medical director of Hilltop Home in Raleigh. This is a private, nonprofit intermediate care facility which provides residential care to 22 children with severe developmental disabilities that render them too medically complex to live at home. Dr. Galla serves as the primary care pediatrician for all of these children and is honored to be part of their comprehensive care team. Most of these children are wheelchair-bound and rely full-time on various medical devices, so her flexibility and autonomy uniquely position her to travel to the children, rather than requiring the coordination of staff and vehicles to transport the kids to her. Prior to accepting the role of medical director, Dr. Galla served on the board of directors for Hilltop for 2 years. She first fell in love with caring for children with special needs as an assistant teacher at a school for orthopedically handicapped children in California during summers in college. While back at school in Durham, she volunteered at Lennox Baker Children's Hospital as a tutor for children with chronic disease who missed school on account of prolonged hospitalizations. When she is not in the office, Dr. Galla cherishes time with her family, riding her Peloton or running outdoors, hiking with her dogs, playing piano, and gardening. Thank you so much for tuning in. Find out more about direct primary care, including resources, discounts, my fave tech tools, books, and more at mydpcstory.com. The mapper has been updated so you can look for practices by specialty. So follow us on your social media platforms with our social handle at mydpcstory, and be sure to subscribe to our newsletter and, of course, the podcast itself so you won't miss out when the next episode drops. So with that, let me welcome our guest. Welcome to the podcast, Dr. Galla.
Thank you so much for having me.
It's such a treat to have I still consider you a fellow Californian. We have been talking since the days before you opened online. It was so wonderful to meet you in person a couple of years ago in Kansas City. But I have to drop this note here because it is so cool that you used to have a place in the town that I'm sitting and talking to you in rural America. So it is so cool to talk with you finally long term now.
Yeah, I agree. When I found out that you had an office right next door to the little market, the mountain market where we used to shop when I was a kid, that was just too crazy to believe. And nobody, certainly where I live now, knows anything about Big Trees, California. So it's really nice to make that connection.
Oh man, it's such a small world. And I really think that, especially when you talk to people in DPC, one of the things people talk about, especially if they're in residency or medical school, is what if I want to practice where I'm not known because I didn't do residency? And you were practicing in California for quite some time before you moved to North Carolina. And
right.
It really does not matter because, especially when you're in DPC, you did it in fee for service, but especially in DPC, when you start getting your reputation and that word of mouth out, just like you have at your DPC now, it's incredible to see growth, which you have immensely experienced. It is so awesome to hear another pediatrician share their story. When we talk about your transition from California and the life that you had here, and then going to North Carolina, I want to ask about job selection because you had experience already on the East Coast, but when you moved back, what did you look for, having practiced it at Lucille Packard and having really fleshed out your career in terms of you were beyond residency, you were doing things, I'm sure you found out like what you really preferred to do. So how did that drive your selection in terms of jobs when you moved back east?
Yeah, you're right. I have had an unusual, I think, number of jobs and have had changes in locations and types of practices I've done for various reasons. Getting married, moving from the Marin County down the coast in California, having children, things that caused me to want to do different kinds of work. I also was in urgent care between Packard Children's and being in private practice. So you're right. I had experienced everything. And when I moved back to North Carolina and had been in practice already 11 years, I felt like I had landed upon realizing that I really wanted to do primary care. I came out of residency feeling like I could take care of children in the ICU, right? And I could intubate kids and do a lumbar tap on any newborn. But I wasn't equipped to talk about things like nutrition and development and sleep, ADHD, you name it. And so I think that was some of the reason I went back to being a hospitalist was I thought, well, that's what I'm good at. I'm good at the hospital-based acute care stuff. And at that time did not have children. Once I had kids, I started realizing this is what people need help with. It's really hard to parent. And I learned as much from my patients as they learned from me as I was finding my way within primary care. So when we moved to North Carolina, my kids were 5, 3, and almost 2. And I was passionate again about returning to primary care, but took 6 months or so to get us situated and figure out where I wanted to work. And I basically asked around, like you said, I was completely unknown. I had gone to undergrad and med school in the 90s, and I had returned in 2012, right? And so I basically asked around among parents where my children went to preschool and did my research and landed upon a practice that I felt really good about at the time. It was not hospital owned. It was one of the few private practices in Raleigh. It was the oldest pediatric primary care office in Raleigh. And it was just a few physicians. And I think they really kept up with evidence-based medicine and provided what sort of felt like that small town feeling of care. Lots of multi-generations of people came there, right? And so we saw babies whose grandparents talked about how they brought their children there. And that all really felt good to me. But over the course of the 9 years that I was there, I think so many changes happened in primary care as a whole, right? We weren't unique, but we also weren't immune to it, even though we were private. And I saw changes over my 21 years where I felt like we had lost our way in primary care and I needed a way out. And as I say, DPC is the antidote to what's broken, but it's also it saved me because I was at a point where it was either leave medicine or find a new way to do it. I knew that joining another practice in town was going to be no different. I considered urgent care or hospitalist medicine again, but that's not where my heart was. So DPC was a godsend.
It's incredible. And I think that it's possibly making people really emotional listening to you say that, because how important it is to have quality healthcare, especially primary care. And when you have the love of outpatient medicine, you're a pediatrician, you're absolutely a generational doctor by default. And then you were working in a place where you saw people like say things, like, oh, I remember when you were part of a culture. And I think that it is so sad that we feel very much like lobsters that were put in cold water and the water was just boiling around us and we were just trying to do our jobs. And then all of a sudden we're like, oh my gosh, what are we going to do? But I am very glad that you found DPC, your patients, you deserve that, but also to lose a primary care doctor when there is too much of a shortage already of quality access to primary care. I'm so glad that crisis was averted. It's awesome that you opened. And I think it speaks to your experience that you were able to say also that, hey, if I go to another private practice, it's just going to be the same thing.
Yeah, I think you're right. And I do think that it was a little bit unique as I've gotten to know so many DPC doctors and as I've learned so much through the DPC Facebook page and meeting people virtually, is I'm relatively seasoned as a physician for being somebody that's opening a new practice. I've got a lot left in me, but at the same time, I really have been practicing medicine long enough that, like you said, there was a culture shift, right? And the way I started doing things is not the way it became. And so it gave me that perspective and that insight to say, the whole system's broken. It's not this practice that's broken, right?
Totally. And when we just go even further there, one of the things that stuck out on your website was that you were tired of practicing in an assembly line mentality. There was an episode of Real Talk with Kid Docs with pediatricians Dr. Beth and Joe Buchan, and forgive me if I'm not pronouncing your names correctly. Your last name correctly.
You actually are, and I used to practice with him.
Oh, that's so crazy.
He was in Raleigh.
Yeah.
In my practice.
I did not know that. Again, small world. It's like you used to live here and now you used to practice with that. It's insane. But it's one of
he sits in Chapel Hill, so just 30 minutes away.
It's so crazy. He had both DPC pediatricians, Dr. Deanna Berry and Dr. Phil Boucher on one of his episodes or one of their episodes. And they were talking about how we think about kids, even our own kids. We typically go to the doctor in this country when a kid is sick. And you have the ability now as DPC doctors, I say that, and I include myself in that boat, but it's like, hey, you want to talk about prevention? That's cool. Let's actually do that. Do you think that this behavior is normal? I don't know, but we have the time to discuss it. When people hear assembly line medicine, it is a very low threshold to associate that with fee-for-service.
Yes. Yeah. One of the ways in which I feel that DPC, when you talk about behavior in particular, has been so life-changing for me is that the way my clinic is set up is I don't even have my front area. I don't even call it a waiting room because nobody has to wait, right? So when they show up, I see them right away. But my front room is full of toys. And I have snacks and I have popsicles and I have books and things for kids to do. And they generally run in here and look forward to all of the things that they're going to get to do here. And I get to observe them. And a lot of what I'm doing is just observing as I'm visiting with their parents in a casual, friendly way. And I know for certain that in my previous practice, they would have been whisked back from the waiting room after sitting in a room with a bunch of other sick kids and absolutely nothing to do, with a parent trying to control them. And they would be pulled back, of course, late, because there's no way you can run on time when you see 40 patients a day. They would be stripped of their clothes to be put on a scale by a nurse who they've never seen before. And when I walked into the room in a hurry, they would already be crying. And the parent is going to ask me a question about their speech or about some behavior or about their socialization or whatever. And I have no experience with the child besides anxiety and crying. And it's completely different now. I don't hand patients questionnaires to find out how they're doing on their developmental skills. I just watch. And it's completely life-changing. And I get so much better of a sense whether to be concerned, whether not to be, and to see where kids are. And I can do that not only because I have the time, but because I have the autonomy and the space to not have an office full of children and full of sick kids. It's pretty amazing.
Yeah. And you also have the flexibility to do the care as needed. So I think about a kid with autism that had to come in for some semi-acute respiratory issue at my old practice in fee-for-service. And it was like, you have to bring them into the clinic. Like, could we do a video visit? Could you just like take a video and send it to me? Could you just talk to me over the phone? No, because I don't have a code to cover that. And now I was in the Philippines at a memorial service and somebody sent me a HIPAA compliant video of a cough and was like, based on this video, can we talk about my kids' health? Sure as heck we can. Sure as heck we can. And it's beautiful when you literally can do what needs to be done. And that sometimes means some people do home visits, some people do virtual visits, but whatever is needed is an option in DPC.
Yes, and kids are pretty different as patients, right? And using the same protocol of this fast-paced office setting, it just doesn't fly with them. And their experience is going to be universally negative. And my experience of the child is going to be unrepresentative of what they, in fact, are like.
In your bio, the sentiments about even time to relay test results or time to speak with specialists, can you give examples of how it's not even just the time with the patient or the family, but it's also the time to give care that's needed to support your plan with the kid and the family?
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yes, absolutely. And I will say that having practiced in this area for 9 years before I opened did really help in that regard. I had my network of subspecialists that not only I knew, but that knew me. And of course, it goes both ways with whether or not they're going to do favors for you, trust your judgment, that kind of thing. I work with such complex kids at Hilltop who all have subspecialists. That's also dramatically increased sort of my exposure to them and vice versa. And so one of the things I feel like I can offer my patients is really knowing where they need to go if I can't help them, and then coordinating that and leveraging my knowledge of the system and whether or not I need to have help expediting something, whether it's just a routine referral, and having relationships where I can have real conversations with these specialists so that I can go back to the parents and make them feel like I actually communicated about your child. I can, for example, I saw a girl today who is struggling with some really severe anxiety and OCD symptoms, and they were coming to me for medication management. And I talked to them on Spruce prior to the visit, got a very detailed kind of history, but also indicated that if we were going to be starting medication, it really needed to be in concert with therapy, and was able to give them recommendations for who would be a good therapist. Those therapists are people that I know and have lunch with and share patients with. And I was able to tell the family before meeting with me, I need you to sign a release so that I can talk with the therapist. So I met with this family today for a little over an hour, and I'm talking with the therapist tomorrow at lunch. And there's absolutely no way any of that would have happened in fee-for-service.
And I think that this speaks to, it's not the doctor that's typically the problem. It is the system, like you said, the culture, like we've been talking about. Because how many people, including when we were in fee-for-service, wanted to do these things or tried to do these things, and we end up, sorry, I can't make it home for dinner. I gotta call someone. I'm not getting paid for this. It's just the right thing to do because I need this patient to get care, and they don't understand if I just send a fax to say, like, you need to get this patient in for an urgent referral. It's so personable what you are doing because you have the time to do it. And I just think that is exactly like feeding into why patients in no matter what community you are in want DPC, even if they don't know that it's a thing. So let me ask you there, when you decided, I've done 9, I'm not going to be doing 10, I'm going to transition. When did you learn about DPC and how did you start planning to transition to your own practice?
It was honestly really serendipitous. I would say that my dissatisfaction with the system was already evolving, and then the pandemic hit. And like it did for so many of us, right? It was a game ender for me. And I knew I needed an exit strategy. I really struggled morally with leaving patients at a time where patients needed so much, right? But there's really only so fast and so hard that you can push for so many years before you break, right? And so I was at the breaking point, and I actually was on our local PMG Physician Moms Group Facebook page for the Triangle area where I live. And I can't even remember what the question was that I posed, or it was more of a sort of discussion about what's happened with primary care. And Tammy Waters, who has her family practice DPC down the road, right, commented on my Facebook post, "Have you thought about DPC?" And it's embarrassing to say now, but I thought she was referring to Duke Primary Care, because Duke owns tons of the primary care offices around here. And I thought, why would that fix my problems? Love Duke, go Blue Devils, but how is that going to fix my problem? And so we started talking offline, and she's, no, direct primary care. Truly had not heard of it. And the moment I heard, literally the next day, I gave notice at my office and I started planning to open my practice. And I think I gave notice in mid-October. I had a 90-day stipulation in my contract. And so I left February 1st and I opened April. I was just so jazzed to learn about this and so excited because, like you said, I was already doing this, but at my expense, right? So when I talked to my patients about what was so dissatisfying for me at my old practice, I've been flattered to have them say, "You never made us feel rushed." Really? You were that slammed? We never knew. And I say, that's the problem and why it was so exhausting. I was acting. That was a performance all day long. I'm smiling, I'm nodding, I'm listening. I am listening to you and your child. I am not documenting on my computer. I will do it later, but I will do it later when I'm home with my children. I will do it on my day off. I will do it on the weekends. I had patients who were unable to get in to see me within 3 months. And so I would put them in on my lunch break. I would stay late on a day to see them because I wanted to see them. I would give a select few my cell phone number. Things that really just honestly burned me out and took away from my family.
Yeah. And you have 3 yourself. I have 2, like we were just talking before I hit record, like when we started talking, when you opened your practice 2022, it was, you're like, how old are your kids? Like they were not that old when we were just initially talking. And it's so crazy how time flies. And this is where, especially if you have something that you need to appreciate, whatever it is, it's like a puppy, a human puppy, whatever it is, like the time flies. And financial rewards of being a doctor are one thing. Yes, you need money to survive, fine. You need to pay off your loans, fine. But you also should always look at, what is my life reward that I'm getting out of whatever I'm doing, whether that be fee for service, DPC, whatever it is. But it's like, when you think about lost time with people, when we think about people who have passed, it's can't get that time back.
No, I have some regrets, that I sort of didn't figure this out sooner. I don't blame myself in the sense that I think DPC has not made its way into the pediatric world as much as I would like, or as it has into certainly family practice. And we have a huge problem with a shortage of pediatricians in general. And I think 252 spots went unfilled in pediatric residencies. It's a crisis. And I'm concerned about it, but I also completely understand it, right? Is that if it's not going to be lucrative and it's going to slowly kill you and keep you away from your own children, why would you choose it? And you end up, with a bunch of med school debt that you can't pay off.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well-child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
Absolutely. And another DPC doctor, she's in her 50s, but I remember she had celebrated, like, I paid my last check, and that is crazy. That's a totally separate conversation as to why do primary care doctors get like the bottom of the barrel when it comes to reimbursement, and why are we expected to still pay the same loan rates, all of these things, like a specialty care doctor? Like, it's crazy. Another conversation, another day. But just going back to Tammy, of all people, leaving that comment, it's like, you can totally picture her, especially you and I, like leaning in and being like, have you heard of DPC? Like, I just love that. Yeah.
She proselytized and converted me and was super supportive. Shout out to Tammy. Allowed me to use her office for my photo shoots when I was creating my website, gave me all sorts of information, really helpful. And that's the feeling of DPC that's also unique. Happy doctors, happy patients, but doctors also helping each other.
Absolutely.
It's just not always the case. And you talked about that woman paying off her loans at 50. I'm in my 50s and just took my first 2-week vacation in my career. It wasn't looked upon favorably. If I didn't work, I didn't get paid. So it was financially a pretty hard thing to do. But also the culture was just as it's been since I was a resident. Suck it up, right? And what was considered mental health care or self-care was being sent a podcast on mindfulness, or a catered lunch during a lunch break I didn't have, or that I spent talking to patients or seeing patients anyway. That it doesn't make anything better.
Not at all. And I just want to point out, especially for those people who are like scratching their head or relating to what you're saying, like, you got paid for all of those 2 weeks of vacation, and you took vacation, period. Now you have a totally different way of being able to live life because you're a DPC doctor.
Right. And I felt the urgency I have now. My boys will be all in high school together next year, freshman, junior, senior. And I'm acutely aware of the fact that I'm not going to have kids at home a lot longer. And I really didn't like the person that they saw me being and that they came home to every day.
Every one of us has things that we look back and we're like, wow, like that's that time. Wish it could have been different for you. I'm sending you a big hug across the internet because it breaks my heart hearing that. I am glad though that your boys are healthy, that you are healthy, that you are able to do these things now and to intentionally plan that future. Because I think that just like how you heard about DBC and your mind shift changed, or your mindset changed, your mindset is changing and has changed already with the idea that like, oh, they're not all going to be here in a short amount of time. And I think that it's, yes, we can't get time back, but we can make the most of what time we do have. And I think that, again, it's like, this goes back to the rewards of DPC are not just financial.
Right. Yep. But also we can do DPC without taking a financial hit, which is what is so beautiful. Right. And I think
Absolutely.
there's a lot of fear among people that are so used to the system, right? They just can't believe that there's another way to do it that also pays you a salary that might even be more than you were making.
It is mind-blowing, especially for primary care doctors, especially for primary care. There's on Dr. Rebecca Bernard's episode of the Patreon, she talked about how she saved $3 million in retirement just since opening her DPC. Wow. What? That's insane. Sorry, I just like totally blew people's ears off with that what. But this is not fake news. Like, this is real stuff that you can project easily when you're like, okay, I'm a doctor. I work with my patients. I work for my patients. They pay me. I have this many members. This is my overhead. This is my tax rate for my state, my federal taxes, et cetera. And then it's, oh, that's it. And you can play with those numbers. Have staff, don't have staff, virtual staff, in-person staff, all the things. But it literally does not in any part of that make you frantic as to, oh my God, CMS decreased the rates of reimbursement for this code. What am I going to do? I have to see more people. Right. None of that comes into play.
That's right. Very freeing.
When you went now from being a pediatrician, a mom, all of these things to like, and now I'm going to be a business owner. I love that you had mentorship with people like Tammy, you had mentorship online, but in terms of going through the motions of opening your own business, like I know some of these answers because we were like in the thick of it when you were picking EMRs and all the communications and all this stuff. But can you speak to what were some of the biggest, like, all right, I got a big hill to climb opening, and how did you get past some of those hills?
It's funny. I get asked from other people who are interested in opening DPC practices about some of the nuts and bolts of what I had to do. And I realized that it's almost, any traumatic experience where you have amnesia and where that is. I literally was so eager to leave what was a miserable situation this part of it wasn't traumatic, but leading up to it was traumatic, right? That I was on a mission. And so in literally a matter of months, I did everything. And I find it more daunting looking back than I did at the time. And I think some of that was naivete because I would start to do one thing and then realize, oh, I can't just get point of care tests. I need to get a CLIA certificate. But just kept rolling into the next thing. And so it really did not feel overwhelming to me at the time. When I look back and make a list of everything I did, I don't know how I did it, but I'm proof that I was doing that while working, right? While working, while mothering, all those things. And the DPC group has been so instrumental in making that easy. Also, I read every DPC book that there is, and it was spelled out for me in a way that was tenable.
That's awesome. And I hope it's reassuring for people too, because especially now when this isn't 1997, this isn't 2007, the number of resources and the barriers to starting a medical practice under the DPC model, medical school is way harder, just to say that. That's a fact. Yeah. So
I will also say that something that I feel like really benefited me was to come at this by saying we all have expertise in different things. And I don't have an expertise in web design, in bookkeeping, in office design, in whatever it may be. And I hired experts. And I felt very strongly about, I want to do this correctly. And I think that helped me get off on the right foot and feel less overwhelmed. That from the get-go, my books were solid because I had somebody who was good at it leading me. I had financial advisors when I wanted to offer a 401k to my employees. Every single thing that I did, I'm learning a lot. I know a lot more now, but it was not in my wheelhouse. And so to some degree, I think you have to have a lot of guts and fearlessness about learning new skills, but you also need to have humility in knowing I am a doctor. That doesn't mean I know everything. And I have relied so much on all of my people, my team.
It's that warm and fuzzy feeling because it is so true. Like I don't think I've talked to a single DPC doctor who has not gotten that same feeling from this community in terms of there has always been someone that someone has talked to as they're starting, as they're going through their first patient to churn, their first, oh my God, I didn't have this supply and I had a patient in the room. Like all the things that we experience as DPC doctors, you have some shoulder to lean on. So I think it's awesome. And this has been said before, but it's not in all doctor communities where you find people who are holding each other up rather than climbing on each other's shoulders.
Absolutely.
Yeah. So when you were, looking at, I'm going to do this so it's solid and I'm going to open in just a few months, you had a space. If you're watching the YouTube, you can see it. It's beautiful. But can you tell us about finding your space and the journey to get Sweet Bay Peds, the brand, up and running?
Yeah, so I think I was driven mostly in my search for space inconvenience to my patients while respecting the stipulations of my non-compete clause. Essentially, all of my patients, 95% probably live in Raleigh and lived in a neighborhood surrounding where my practice was, which was in a neighborhood. And it was important to me to not have my move be an inconvenience to them as much as possible. And so I had a non-compete radius and I used that to look for spaces basically immediately outside that radius. And that also had a route through the city that was convenient for them. There's lots of construction going on here. The triangle is growing at a rapid pace. I didn't want traffic to be an issue for them. So that kind of informed the first thing. I lived about 35 minutes south of where my practice was in Raleigh. So it was a no-brainer to me that if I'm going to have to go outside this radius, I'm going to go further south so that I cut some of the distance to my house. And then it was also really important to me to have a space that felt like a medical facility. It was just a personal preference. There were less expensive places that were in a small strip mall or next to a restaurant or a business that wasn't medical. And of the spaces that I looked at, those didn't feel good to me. And because I'm in such a medically rich community, there were so many opportunities. So I wanted a building that had other good physicians in it, nice practices, parking, elevator for strollers, and you're talking to me on the front here where I don't have windows, but in the back, I have giant windows with blinds that I open up and I've never pulled down and a bunch of plants. And I needed it to feel good, right? And at my old practice, I didn't even have windows in my exam rooms and it wasn't good for my soul. I don't think it was good for patient interactions. So I just needed it to tick all those boxes.
I still remember when we were talking plants and I was like, I think I sent you a picture of our former clinic and how I had all these plants and you're like, oh my gosh, these plants are great. I was like, they're all fake. I never have to water them. And then you have your beautiful snake plant, just like live breathing thing. And it's so personal to you. Like your brand is personal to you. And I've loved seeing the evolution of it. And I love that your patients are able to go to the space that you've created where they can have a whole area just to play with toys. Like it's not the waiting room, it's the toy area. It's so cool.
Like the living room. Yeah.
Yeah. Totally. And DPC doctors who are already in practice, they know that. It's such a joke that the waiting room is not used for waiting. Dr. Teresa Wong she specializes in geriatrics down in Southern California. She put in her social media, like, on her little tour of her office, like, this is a waiting room, and DPC, nobody waits in the waiting room. I love how that's our culture, rather than, I'm sorry, it doesn't matter if you're sick or you're well, we wait in the same waiting room for 45 minutes to an hour and a half. We all know that world. So it's a wonderful culture to be a part of in DPC. What about your brand? Because people have talked on the podcast about, do I include my name? Do I not include my name?
Yeah.
Especially with people going outside of your non-compete radius to find you. How did you work? How did you balance, my patients need to find me, I need to be searchable, and I need to have my own brand?
Yeah, that's a good question. And I definitely struggled with it. And I toyed with the notion of Galla Pediatrics and bought the domain. But ultimately I thought, same way I feel about my Instagram account, it's not about me. It just isn't, right? It's about the kind of care. And ultimately, I want it to be something that I can grow to be bigger than me and to last longer than me, right? And so I just didn't really see my name as being a part of it. So I was going through a pretty difficult time when I opened my practice. My sister-in-law was diagnosed with appendiceal cancer, which is rare and aggressive. She lived in Durham. She and my brother went to Duke. I went to Duke 2 years after them. I met her when I was 17. She was as close to a sister as you can get, and they have 3 children. And I was an aunt long before I was a mother, and these kids are real special to me. And she passed 17 months after her diagnosis, just really in my first year of being open. And she just meant the world to me. And when I was naming my practice, as well as just reflecting on what was important to me, just nature and this fresh air and health and holistic health, it all just had this sort of nature vibe to me. And she and my brother had this beautiful magnolia tree in their front yard, which was not, I don't know, it was just this sort of quintessential look to their house. And it was something that was very Southern to me. And there is one type of magnolia tree called the sweet bay. And it is unique in that it's used for some, or has been used historically for some medicinal purposes. And it just all came together as having some meaning to me that may not even be apparent on the surface to other people.
Now they know, though, because you just shared it. And I think that is the stuff that goes to the root of why I even created this podcast. I would go to these summits, just like where I met you, and it's what would I remember is the stories. It is very hard to unhear what you just shared about your brand. And you know that your patients are feeling that when, like, they see your real plants. Your brand is not even just in your colors and your logo. It's in you. It's in your space. It's in the way that you care for people. It's just amazing. So let me ask your website, because you said, like, you're not graphics designer, the person who's like, I'm going to wear all the hats and like wear myself ragged. That I will reflect on that. That was me. But like, for your website and your copy, how did you get to your amazing website as it is today?
Oh, thank you. I wrote all the copy myself, and I am pretty clueless about web design and graphic design in general, but I have a cousin who is super skilled in those areas and went to Carnegie Mellon with a woman who became a web designer who was really talented and was located in Pennsylvania. But so she was like a best college friend of my cousin, and she put us in touch. And I've still never met her in person. And she's wonderful. And we had a phone call where we discussed my vision. She was a great listener. She's super talented. And she did a great job of capturing exactly what I was going for.
Amazing. And as it should be. And now let me ask you, with the tabs that you have along the top, I wonder, do you see traffic just going crazy on one particular tab versus others, especially since you've been open to now?
Stay with us. We'll be right back.
Hey, business enthusiasts, ready to boost your entrepreneurial journey? Tune in to the Growth Gear podcast with Tim Jordan, presented by Carbon 6. Tim dives into cutting-edge business growth strategies and new brand insights. Whether you're a startup founder or a seasoned exec, gain the tools to elevate your business. Subscribe to The Growth Gear with Tim Jordan on your favorite podcast platform. Shift into high gear. The Growth Gear is your guide to fast-paced business success.
That's a good question that I can't answer. I have no idea. I don't know if she tracks it. I certainly don't. I don't know. But I will say that I have also been very fortunate that I have not ever needed to market. And so I'm not even sure. I'm sure people do look at my website. And when I was first opening, I'm sure they did. But my practice was really built from relationships I had over the previous 9 years. And yeah, I think a lot of people just, what they needed to be educated about was the model and not really about me. And so I think that education happened early. I don't know how much people look at it now. I'm currently working on a wait list, just paused over the summer. So good question. I have no idea.
Tell us more about what is your day-to-day like? What is your patient load like per day? What is your busiest day? And what is your slowest day like at Sweet Bay Pediatrics?
Yeah, sure. Backing up to leaving my other practice, it was important to me, obviously, to follow the legal stipulations of my contract, which was that I could not solicit patients. And so one of the things my web designer helped me do right from the get-go is create a landing page. And I didn't even have my name at that point. I think it did say Galla Pediatrics or something, but basically I was able to tell patients at my old practice that I was leaving. I was not allowed to tell them where I was going. I basically made my landing page searchable. And at the bottom of the landing page, it said subscribe for news. And that's how I wasn't allowed to take demographic information or anything from patients. And my patients were wonderful and they did it. And so they subscribed for news and I kept people up to date. And then Raleigh's a pretty small town, and my patients, I joke how incestuous my practice is. Literally all of my patients know each other. They're related somehow. I have a wall that is filled with my patients' pictures, and they send me their Christmas cards, and I put them up year after year. And the kids, one of the things they love to do is walk down that wall and say who they know and who's in their class and who's on their swim team. And so I had the advantage of I had that huge network working for me so that once one person found out where I was going, someone else, they shared the information. So it was all word of mouth and I was able to open, I can't remember, but something like 110 patients maybe were pre-registered. And then people slowly trickled in and found me, some of whom were never my patients, maybe were at my old practice, but had seen me for a sick visit or just tired of the same thing we all tired of with the old practice, right? And heard about how it could be. I mean, you can text the doctor. You can send photos. You can send videos. You don't have to just go in. You don't just talk to a phone nurse. And so I grew pretty quickly. So I would say that I essentially filled within 2 years. There's been relatively little flux. There's more been a change in what I feel like I can handle. The reality is that part of being my age and having done this for as long as I have is that I ultimately want to be part-time. And that is, I would say, been the biggest challenge for me with the DPC model is that I came from a practice with 9 doctors. I'm 1 doctor. I came from a practice open 7 days a week. I'm open 5 days. And ultimately, I'd really rather work 3. So what I do now to simulate that is I schedule all of my well cares 3 days a week. I'm available for sick visits the other days. And so those days tend to inherently be lighter. I do 4 or 5 well checks a day on the 3 days that I'm here, and I squeeze in as many sick visits as need to be seen. And I would say that usually ranges from 2 to 5 kids. Not crazy. And then I do have this other passion for working at Hilltop Home. And so I need to work that into one of my sort of non-clinic days here. And so that makes it so that in the long run, I think it will be nice to expand and add a physician. But still, as we all say, the hardest day in DPC is nothing compared to the easiest day in free for service.
Yeah. And I was laughing a little bit there right before you said 2 to 5, because I'm sure that there were people who are like 10, like 12, like 20, like what? And you're like 2 to 5. It's
Yeah.
I mean, I saw the like smirk come through your face
Yeah.
after. It's
Yeah,
like,
because it seems unbelievable.
yeah, yeah.
And obviously there's outliers. I have days where nobody needs to be seen. I have days where I have 8 and I work them in. But the beauty of my schedule is that the visits are so generous in length that squeezing someone in is never actually double booking them, right? It's just that maybe I typically don't even have patients overlap in my waiting room. I have some days where they do, right? But they know each other, so it doesn't matter. They can have a little reunion in the front room. It works.
Because they know each other anyways. It's awesome.
Seriously.
So let me ask you, because I totally hear you in terms of the future, having another doctor come on, even just your brand, Sweet Bay Pediatrics is not your name, so you have the ability to grow and expand even in different locations. But
Yeah.
in terms of staffing, along the way, you've hired, and correct me if I'm not pronouncing this correctly, Jahira, as well as Holly. And so I'm wondering in terms of, I see more micro practice. I see the model of the micro practice, a single physician owning their practice, very common in primary care, especially when people are starting, more so than opening with a big group of people or having staff from the get-go. Some people do it. I did. In terms of finding your people, how did you guys find each other?
Yeah, good question. When I opened, there was a third person that you didn't mention because it was short-lived. I opened with an RN who had worked at my previous practice years ago. Of course, another stipulation in my non-compete was that I couldn't hire staff, take staff with me, et cetera. But this woman had not worked for years. She was excellent. I knew I liked her. I knew we got along. She had taken sort of a hiatus from working altogether, thought this sounds like the perfect segue to getting back into things. And she was here only a few months, and very mutually we parted ways because she decided that she actually didn't want to get back to nursing. And I realized that she was completely overqualified for what I needed her to do. So I was paying her RN rates and she was rooming patients, doing a little bit of admin stuff. I have actually not shared any of the admin duties that are like the bigger picture, registering patients for the practice, doing all the billing. I do all that on my own, and I've never had help doing that. But having an RN, I never have patients get advice from anyone but me. So even though her advice probably would have been solid, there just really wasn't a role for an RN. We parted ways, and I actually put an ad out just on Indeed for a medical assistant. And I probably got 23 applications within a couple days, and really just so fortunate that I picked Jahira to interview. She is just the best. And so she's an MA, and it's very appropriately trained for kind of what she does. And my patients love her. And really, we just sit by side at this big desk behind me. I have an office in the back that I never sit in. We basically use it for storage because I like to greet patients. I like to sit next to her. I have one printer, I have one scanner. And so we share everything and sit at the front. And she is a fast learner. She's smart. And she not only rooms patients, but obviously does all of my Vax care stuff and will do anything I ask her to do, figures out computer systems. We're just figured out how to print labels for lab samples, but also I'm going to start dispensing meds. And so I needed to get a label printer and that kind of thing. And so I order things and then the box arrives and she has at it and she reads the instructions and she gets everything going. So she's wonderful. I did hire a nurse practitioner 6 months ago. Honestly, I was very concerned about burning out. I realized that I took this venture on with so much passion and excitement that I thought I can do it all. And it's no big deal to be the only physician here. And to be on Spruce 7 days a week. And 2 years in, I thought, I need to be careful, right? And so it's pretty hard to find a doctor for a variety of reasons. And I'm also really picky, right? I essentially view it as a marriage. And so I'm not going to marry just anyone. So Holly was a lactation consultant, is a lactation consultant who I had known from my previous practice and knew that she was great. And she and I decided to work together, and she sees some sick patients on the days that I am over at Hilltop. Ultimately, I think that it's incongruous a little bit for my patients to be seeing a mid-level when what they signed up for was me. Yeah. So I think that in the long run, even though she brings some wonderful things to the table, including cranial sacral therapy and some sensory processing disorder kind of knowledge and mental health support, she's really skilled in those areas. I think when it comes to seeing sick patients and making plans for their health care, it's really better done with me or another physician.
And I think that you're doing this, like you are an entrepreneur, and this is a normal thing with entrepreneurship is like, people come, people go, things happen, you change your practice, whatever it is, but this is the journey. And I think it is cool how you had one person who was not known to you before, and then you've had the experience of knowing people, and that's awesome to hear that Jahira is so great at what she does, even though you didn't have a word of mouth recommendation or you hadn't worked with her before, and you had less of a barrier to like, okay, I get who you are and what you're bringing to the practice. And it's just like coaches. Like I think about people with coaches, it's you don't necessarily stay with a coach your entire life. Like you could do coaching and then you move on, but these are businesses that we're running and these are business decisions. And not to say that we are not emotional about decisions, but at the same time, I think it's important to think about, just like you said, the level of care that I am wanting to deliver. Is this in alignment with what, my patients are wanting and expecting? Fill in the blank. Yeah.
Absolutely. And the stakes are higher, I think, when you are the practice owner. And I'm just so proud of the care that I think DPC can provide, that it's really important to me to keep that standard of care really high.
Love that.
But it's definitely tricky and it's a lot of work.
Yeah.
It's just really rewarding.
Yeah. And this is perfectly leading me to my next question, because with you having been a pediatrician who has been at different practices, different level of acuity, and then you chose to do DPC, from your perspective, what do you think are the big barriers that as reasons why more people who are in pediatrics are not choosing DPC or not going into DPC as of today?
I think the number one reason is just a complete lack of awareness that it exists. It is truly unknown. Patients and doctors alike, right? Myself included, right? I didn't know what it was. And so I think it's lack of awareness. Then there is also just this, what's the word? This almost like codependent relationship, right? Between doctors and this fee-for-service world where they're used to getting beat down and they're used to seeing this many patients a day and being compensated in this bizarre fashion by third-party payers, all for the promise of job security and maybe health benefits. Right. And people that I have talked to who have been very interested in considering DPC, many of them shy away from it because it feels like this uncertain and unguaranteed future. Right. If you go to work for some big, busy hospital-owned practice, you're going to be busy and you're going to have plenty to do. That is not a guarantee with DPC. You have to work for it. And obviously, I think many of us have proven that you can be plenty busy and plenty successful, but it's a leap of faith and it's a willingness to try something that feels really new and scary.
Very well put and very realistic. So I think that is definitely, but it also calls out something that I would encourage people who are listening, like, if you went to medical school and you have a friend who was in your medical school class who is a pediatrician, if you're best friends with a pediatrician who takes care of your kids, whatever it is, like every single Uber or Lyft driver I have ever sat in since I learned about DPC has also learned about DPC, whether they like it or not. But I would say to your point, tell people who are in pediatrics, tell people who are in cardiology, tell people, period, because you never know. Like like you said, you're in some random moms group in the Triangle, just saying something about practice, and Tammy just happened to be there. It's so uncanny how these connections are made, but the connections affect change. Clearly, all of the people at your practice have experienced the repercussions of Tammy saying that.
Yeah. And I also think about how many people, because they don't know it, are not looking for it. right? If you don't know it exists, how can you look for it? And so I think there are plenty of people who, like to believe that they are happy in their fee-for-service job, but it's only because they don't know another way. And like you said, spreading the word so that people understand that it doesn't have to be the way it is.
Yeah. So powerful. So that is a wrap for today's main interview episode. I'm going to be talking with Dr. Galla even more about her journey in becoming the medical director for Hilltop Home, bringing personalized care that she brings every day to her patients at Sweet Bay Pediatrics to the children with severe developmental disabilities at Hilltop Home. So be sure to join us for this conversation. We're going to be talking more about her future, the 401k that she mentioned, and you can find that conversation in the Patreon community. So thank you so much, Dr. Galla, for joining us today.
Thanks for having me. It was great to see your face.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.